These are Army and Navy retractors. These are the basic retractors, and you will see these retractors in every single instrument tray that you do. So if you see this on your exam, for example, what is the basic retractor that's in the department? That would be Army and Navy. Okay. So getting back to our pig, and we're sorry about our last. Well, we have two videos because the other video we had a little technical difficulty, but I'm going to continue. So in the other video, you saw the heart and the lungs. So now I'm going to open him up more, and I'm going to expose the abdominal area. So the abdominal area has something called an apron. It's an apron on the abdominal area. And when we're heavy, when we big, so to speak, that apron swells and it's fat. So I'm cutting it. You see? Okay. You're going to cut this baby open to the bottom here. So we're going to expose the digestive system now. Remember I said that your esophagus goes from the mouth to the stomach. So we're going to expose, is that actually right here? Remember the fascia from the chicken? This is the fascia. Okay, so as you can see, we got to cut some of this fascia off to expose this without hurting the urinary system. Okay, so I'm going to expose this here. So you can see the liver, the intestines, okay. Okay, so what I'm doing is I'm trying to expose the digestive system without messing up the urinary system. Just note that your kidneys are your last two ribs on each side will be your kidneys. This is why a lot of times you have back pains when you have urinary issues. But I'm trying to get this out of here, honey. Okay. Well, first of all, let's take off the liver. That might help. Okay, so the liver, this will be the liver. Ooh, this liver's big. This particular pig got a big liver. I'm not sure if I can try to get the gallbladder coming out. So when you read about digestive system, the excuse me, the liver, the spleen, the pancreas, those are all accessory organs. Your major organs is your esophagus, your stomach, your small intestines, your large intestines, your colon. But we're going to try to just take away this liver here without tearing up everything. Give me a minute because I want you to see. Now this flap here was the stomach. See the stomach? That's the stomach. And the stomach branches into the small intestines, which is right here. And note that the small intestines, and I don't eat this, because some of you eat something called chitterlings. I don't eat that. But people eat chitterlings, and what they are actually eating is the pig intestines. So I'll show you here's the liver of the pig. And in contrast to humans, the liver is about this big. Now, some people have fatty on their liver, fat. It's only because they gain a lot of weight and they call themselves obese. But the liver has a gallbladder, which is this little gallbladder which sits underneath. Right here would be the gallbladder, the liver, and that holds bile. So when the person gets their gallbladder removed, they still can function without the gallbladder. It's just that they have to get medicine or injections, or they got to watch what they eat, especially with the bile. And this helps regulate sugars and carbohydrates and starch. The liver helps get rid of waste as well as the kidneys. So this is the liver. This is what the liver looks like. And remember that the liver is an accessory organ to the digestive system. Okay? Still looking at the pig. Okay, so this pouch right here would be the stomach. And we all have a stomach. And as you can see, this stomach branches into the small intestines. So the first row of the small intestines is called a duodenum. After the duodenum, then you have the jejunum. Then you have the ileum. And this ileum is attached to the colon or the large intestines. Everybody see that? See this? See the large intestines? And this large intestines is the gray. So you have ascending, descending. You have ascending, transverse, and descending. The descending colon goes into the rectum. And of course, the rectum going to the anus is where your boo-boo come out. So I'm going to cut through this digestive system because I want to actually expose the kidneys so you can see the kidneys for itself. Okay, so I'm going to take these loose. So let me show you can see what I'm doing here. I'm going to have to actually cut into the colon to remove. Now, on a other note, if a person is doing a autopsy on a human being, this stomach is full of hydrochloric acid. So what it's done is, when the stomach is open, we're going to open up the stomach and see if anything comes out. But when the stomach is open, this has to be run underwater because if it don't, the acid could burn right through your gloves. I'm going to open up the stomach a little bit. And yes, see, I don't know if you've seen some of that come out. Yes, that's hydrochloric acid. And then, ironically, you can actually see what the person ate. And look like he had something, I don't know if we can see this. Look like the last thing the pig ate was in the stomach. I don't know if you've seen that or not. But this hydrochloric acid in this pig will not hurt my gloves because it's been sitting in hydrochloric, the hydrochloric acid will not burn through my gloves from the pig because it is sitting in formaldehyde. Had I opened up the pig, I would have had to run water in this stomach so it wouldn't burn. Okay? All right, so I just want to finish with the digestive system. So you got to actually cut through here. So what I'm doing is I'm cutting the fascia to separate the digestive system from the urinary system. And just a note about this is the vein I was telling you about, the vein that's coming out like this. This is the abdominal vein. And these veins are really, really big. These are part of the inferior vena cava that's going into the heart. So the inferior vena cava is the largest vein that drains from the bottom, like from your leg and your toe and your bottom, your stomach. The inferior vena cava, the superior vena cava drains the neck and the face and the head. Okay? So we're going to see if we can try to cut this through here. Hopefully you're still with me. Okay. I don't want to cut the kidneys. I want you to see how the kidneys look. Oh, good. We didn't cut the kidneys. So this is the digestive system. And this little portion here, which I unfortunately cut a little bit of it, is the spleen. You have the spleen, and the spleen actually is immunity from the immunity system. immune system, excuse me. So if you lose that, and sometimes people outgrow it, but if you lose that, you can still live with that. And then the pancreas is over here, this little white part here, or green part. And like I said, please excuse the green part of it. It's because of the fact that they have, again, formaldehyde. But this right here is the pancreas. And the pancreas help with the insulin. So, of course, when a person has diabetes issues, they need extra insulin, or sometimes people do not. And this right here are your intestines. As you can see, the small intestines are smaller, and they branch into this large intestines here. So that's the digestive system. Now we get into the kidneys. The kidneys represent the urinary system. Right? See the kidneys? The kidneys there's 2 kidneys on each side. Then you have the ureters, and then you have the urethra, and then the bladder. The ureters take all the urine from the kidneys through the ureters to the bladder. From the bladder, it goes through the urethra out. A male's urethra is longer than a female because a male has a penis. And you'll learn all of that when you read. But just to show you the kidneys, I'm going to actually cut through these kidneys here, so you can see the kidney. Kidneys are a bean shape, like a lima bean. Okay. Cutting through. And as you can see that the kidneys sit to your back. So if somebody's kicking you in your back, they can destroy or damage your kidneys, because the kidneys sit right in the back. Okay. Okay, so this would be the kidneys. And as I said, these are the ureters that's coming off the kidneys. Real slippery. It's coming off the kidneys. And just to note, if you see it slippering out of my hand, it's because your body is full of fluid. And the fluid helps and cushions your organs, so that way if you run in and jumping, it doesn't damage. This is one of the purposes of us having our skeletal system. Okay, so now that would be the kidneys, or as we say, the urinary system. And like I said, the urinary system deals with the kidneys. And see, we can open up one of these kidneys so you can see what it looks like inside. That might help. Because when you're looking at it and you're studying it, you see what it looks like, actually look like inside. And as you can see inside, you see the kidneys? That's what it actually looked like inside. It has something called a glomerule. The glomerule is actually a filter. And whatever you drink and eat and put in your body is filtered through this glomerule to the kidneys. This is why when they do a drug test, they do a urine, because it's going through your kidneys. But as you can see that the kidneys have the called a glomerule. Everybody see that? Great. So now we have went through the cardiovascular system, the respiratory system, the digestive system, and the urinary system. So now we go into the reproductive system. The reproductive system will be right here in this area of the pelvic area. So you may see abdominal pelvic area. So looking at this pig, this is a male pig. Because this male pig do not have ovaries. This is a male pig. And how you know it's a male pig is because this would be the penis here. And this long tube here would have been coming off of the kidney, off the ureters, onto the bladder. And this little portion here would be the bladder. This little portion right here would be bladder. It always sits behind the penis. And that is your pig. Okay? I can't really do the skull. I will show you the eye, but because this is an embryo of a pig, because this is an embryo, you know, the eye may not have been developed too much, but it should have been developed. So I'm going to see if I can try to show you an eye. And of course, this is the ear. We're going to try to get the eye. Get this out. And like I said, I can't really show you the brain, but I don't have a saw. And this is hard. And I will have to saw through his skin, his skull. So I can't really get into it, unfortunately. But at least you was able to see the spine, the ribs, the digestive system. It's the digestive system. The respiratory system, which is the lungs. The urinary system. And the cardiovascular system, which is the heart. And if you look at some of these areas here, these is the arteries. See the arteries and the veins. And then, of course, this is the neck. And like I said, it's really hard for me to show you that aspect, but for the purpose of the class that you're learning about those systems, those are the systems. Thank you for watching. Like I said, if you have any questions, it's going to be my contact will be in the description box. Thank you and have a wonderful day.